Today we're in Island Park in Geneva, Illinois. We're meeting with my friend, Dr. LaToya Perry. She's a gynecological oncologist. She treats basically every cancer that women have below the belt.
Hi!
We're gonna talk about the lack of diversity in clinical trials because she sees this all the time. Whenever someone gets a cancer, they wanna find the best treatment, and sometimes the best treatment is a clinical trial. I'm sure we're gonna have a great discussion. We're right by the water, we have the ducks and the geese, and it's a beautiful day.
A big part of what I do in my practice is to get involved with chemotherapy-focused clinical trials to treat GYN cancers.
So, unfortunately, I know that we often don't know about clinical trials.
Yeah.
And I'm trying to figure out what is the disparity? Why is it that there is such a lack of diversity in clinical trials?
It's tough. I think that mainly when people think of clinical trials, they think of like a rat going around in a lab or something
Right.
like that. Being experimented on.
A lot of them, I'm sure you've heard. Oh, am I gonna be cloned? Are they gonna use my stuff?
Exactly.
You know?
Within the African American community, there's a lot of kind of worry that if you participate in something like that, that number one, you could be harmed, and then number two, that you won't get the best therapy.
People need to understand that clinical trials are not the second course of treatment. Sometimes they're the first course of treatment. What ways could they possibly get more people to participate? Do you have ideas on how to do that?
You know what? I think knowledge is power. It's really about education. What I know about uterine cancer is that that's one of the most common GYN cancers that occur. A lot of our clinical trials don't include African American women. More and more, we're trying to recruit those women, and now we're seeing that African American women actually develop a different type of uterine cancer. And therefore, you need to participate in these trials so we can figure out how culture, race, diet, economic status affect our ability to fight these cancers.
Not everyone's the same. So it's really, really important that we do clinical trials on everyone and not just a small population. So that is why diversity in clinical trials is so very important. What can we do to hopefully alleviate this problem and so that clinical trials are actually beneficial to all of us?
I think the important thing to do is to get more and more information out there so that patients can kind of take that power back.
Mobile, is the biggest thing for everyone, especially in our community.
Absolutely.
Mobile devices,
Mobile devices, getting into churches.
Yes.
All those things are important to increase the awareness. And I think when you increase awareness, you can get more people in the know to be willing to go on these clinical trials.
So I just had a really great discussion with my friend Dr. Perry about clinical trials, and the biggest takeaway for me is awareness. We all need to be aware that they're out there and that they need participation.